Hi, my name is Eduardo Fleury, and I'd like to share my experience regarding breast implant and breast implant illness. I am from Brazil and work in the IBCC Oncologia. It's an oncologic center here in Brazil, and we start our research regarding breast implants since 2015. And during this time, we get a lot of expertise regarding the issue. So there is no conflict of interest in our presentation. In 2015, at the beginning of our research, we tried to reach the diagnosis of via ALCL, the anaplastic large cell lymphoma. We saw in the literature a lot of content regarding the issue, and we had one case of the via ALCL in our center, and we start looking for some features in breast MRI that have the same diagnosis of the via ALCL. So we start a protocol in our research to find the findings of the via ALCL. At the beginning of our protocol, we saw that many patients have many complaints, uh, just like the same of the complaints that reported in the BIALCL, but in the surgery, these patients have nothing, and there's only a capsular contracture. So we start searching for some findings in the pathology to understand what's happening with the fibrous capsule. And for our surprise, we find, despite the integrity of the implants, there are a lot of residue of silicon or silicon corpuscles inside the fibrous capsule with a type of granuloma. And we saw that when looking the microscopy of these patients, we could find so that despite the macroscopic integrity of the implants, there are some lesions in the surface of the shell of the implant, and there's a shedding and probably bleeding of this silicone corpuscles that goes to the fibrous capsule and start an immune reaction. And to understand what happens in the fibrous capsule, it's important to understand some features of the blood cells, and especially the monocytes and the lymphocytes that are going to make the immune response for the foreign body. So at first, when this free silicon and the silicon corpuscle get in contact with the fibrous capsule, the macrophage is going to phagocytate the silicon, and then we're going to have this complex. It's an fumi-histiocyte, and this fumi-histiocyte is the key for the diagnosis of the granuloma that we call silicon-induced granuloma of breast implant capsule. And this macrophage activation is going to activate the T cell. The T cell is going to have mitosis and it's going to act against the silicon. And so you're going to have an immune response here. And it's important to understand the how does the lymphocytes work. So at first we have the stem cell, and it's going to be differentiated to a more specialized one, and this specialized cell is going to act. But when we have some consumption of this cell, probably we're going to recruit more younger cells here, and if you have a lot of consumption of the cells, we could have a typical lymphocytes like here. And some studies corroborate to our findings. This is one important study regarding gel bleeding, where the authors search for silicon corpuscles in the body of the women, two women with breast implant illness that send their body to research, and they didn't die regarding the breast implants, but they had their complaints of the breast implant illness, and when searching for silicone in their body, it was possible to see silicone in the intestine and in most of the organs in the body, and this support our findings and the clinical complaints of the breast implant illness. So in our theory is when we insert the implant in the body of the woman, we're going to have a protective barrier of the body, it's the fibrous capsule, and during the time we're going to have bleeding of the silicone content, and this bleeding is going to keep in contact with the fibrous capsule. And here we're going to have the macrophage activation, and this is the Fumi macrophage. And when it's activated, it's going to activate the lymphocyte. Here we can see the lymphocyte, and we are going to have a granuloma here. This is the acute phase of the inflammation, and probably we're going to have a capsular contracture. During a time, this is a self-limiting process, the macrophage is not going to be activated anymore, and we are going to cool down this inflammatory response, and the patient is going to be normal again, but there is probably is going to have a scar with this giant cell containing the silicone. So here is a giant cell with silicone inside, and this is the granuloma. But we are going still having the bleeding of the implant. So the implant is a generator of the gel bleeding. And here, probably during the time, they're going to pass the barrier of the body and goes to the lymph node. And when it gets to the lymph node, it could travel to all of the organs of the body, like we saw in the article. And when we have the response to the fibrocapsule of the silicone, we're going to have an activation again of the macrophage, and this macrophage is going to activate the lymphocytes. But now the lymphocytes is going to act against the silicone in the whole body, and probably this patient is going to have complaints in wherever the silicone is. So here we can see the inflammation and the target organs inflammation where there is silicone. Again, it's a self-limiting process, and when we stop the activation of the macrophage, we're going only to have the scar again, and here's the giant cell again. So the CGB is going to be bigger, but the patient's not going to have the complaints anymore until the next inflammation increases. This is what we see in the MRI, so we can find the diagnosis of the SIGBIG on the silicone-induced granuloma of breast implant capsule at the breast MRI, and here is the mass. It's easy to find and easy to perform the diagnosis. And here it's what we see in the mass. Here are the granulomas, and we can see also the lymphocytes and the macrophages in the histology. So here's the key for the diagnosis of the breast implant illness. But sometimes we can have a dysfunction in this macrophage activation, and at this time we're going to recruit more lymphocytes, so we're going to have a more monoclonal reaction here with more lymphocytes. And as we have a consumption of the lymphocytes here, we are going to recruit more younger cells, and this is the most often associated with seroma, and it's more aggressive. We have more inflammatory changes in this time, and this is our theory that probably This is the target point of the BIA-ALCL. So we have consumption of the lymphocytes in a monoclonal reaction despite the macrophage activation by the silicon. These manuscripts support our findings, so they report the spontaneous regression of and resolution of breast implant-associated anaplastic large cell lymphoma. They evaluated two cases, and they have the same findings at the acute crisis of the BIA-ALCL. We could find the atypical lymphocytes here, so there are bigger cells and differentiated with atypia, with a lot of CD30 positive reaction at the immunochemistry. And when performing the diagnosis 2 months later, 1 or 2 months later, we could see less atypical cells here. So the lymphocytes are less atypical here, with less CD30 positive, and all of these cases are ALK negative, so this is not a true lymphoma. At the time of the surgery, at the puncture, there is only a few lymphocytes, typical lymphocytes here, with the macrophage here, the Fleury macrophage, and CD30 negative. And when evaluating the slides of the fibrous capsule, there's only lymphocytes here, aggregated lymphocytes, and some kinds of free corpuscles of the silicon, and this is just exactly what we described in our research and in what we see in our clinical practice. So when we take away the implant, we are not going to have the activation of the macrophages here, and probably we are not going to have the reaction, and we are not going to have the reaction in the body, in the organs where there is migrated corpuscles of the silicon. So the treatment, even of the BIA-ALCL and the SIGB are just like the same. We just need to make an en-bloc capsulectomy and removing the implant so we cool down the inflammation process and the generator of the free silicon from the breast implants. So when we take away it, we can have the regression of the clinical complaints. This is our manuscript where we describe the physiopathology of the granuloma and the histopathology and radiologic correlation. We published this article in July of 2018. So here we describe what happens with the granuloma, and here we have a dysfunctional regulation of the T cell. So probably at this point we are going to have the ALCL differentiation. So in our theory, when we have the granuloma, we could have intracapsular mass and restricted to the intracapsular environment. And this patient most often is going to have local complaints. Maybe if she had migration of the silicon, she's going to have target complaints. But the main features at the histology here, we are going to see a polyclonal reaction with CD30 negative. When we have a more aggressive one, probably we are going to have an activation and dysfunction of the lymphocyte T with more atypical ones, and we're going to have a monoclonal lymphocytes here, CD30 positive. The CD30 is membrane replication, so this is not a malignancy indicator, but it's a replication indicator of the tumor. So in our theory, probably when we have these findings, we have the dysregulation of the of the lymphocytes by the macrophage activation. And here is, for example, the intracapsular granuloma. Here are the masses inside the fibrous capsule. And in these cases, we have a polyclonal reaction with especially giant cells. When we have more aggressive one, so here it's granuloma, it's not the diagnosis of via ALCL, despite the imaging features of the SIGB are just like the same of that reported in via ALCL in the literature. But when we solve the histology in these cases, we have mainly the Fumi histiocytes, the Fumi macrophage here, with only T cells without atypia, but we can see with little CD30 positive. Here in Brazil, these patients goes to 2 or 3 emergency rooms for treatment of these complaints, and many of these patients, when come to make the diagnosis, they already use an anti-inflammatory drug, and we think that we have less CD30 positive here because we just have the cool down of the inflammation, especially using the drugs. So here is what we describe in our manuscript, what we are going to expect regarding the imaging findings to the histology. So we are going to have, when we have the seroma, we are going to have a more aggressive reaction here. I'm going to use 2 examples of patients that we have in our service. We evaluated more than 3,000 women with breast implants during this period, and we found that granuloma and patients with complaints regarding the breast implant illness in about 40% of these patients, but varies the clinical complaints from more aggressive to less aggressive. The less aggressive most often are just capsular contracture. So this patient, she wants to make a mastopexy, and here is the pre-operatory breast MRI, and this is the 3D reconstruction. 6 months later, when she had the implant inside her body, she started to make a reaction on her left breast. It was interpreted just like an inflammatory change, and her doctor told that it was an infectious disease, so he took away the implant, but there is left here a residual of the fibrous capsule. And 1 year later, today, we can see the fibrous capsule here collecting inside some fluid, and the patient had a reaction in the skin, and we can see the inflammatory process here in contact with the residual fibrous capsule. So the fibrous capsule, there's still silicone inside of it, and this patient, it's important to make the en-bloc capsulectomy, because if we have the residual of the capsule here, probably we're going to still have the complications. And here's the 3D reconstruction where we can find these findings of the breast MRI. It's the changes, it's much more inside that outside of the body. Another patient, this patient went for surgery because she had a DCIS cancer, ductal in situ carcinoma, and she opted to a mastectomy with reconstruction. She used an expansor here with double lumen, that here outside we have the silicone and inside we have the fluid. And 1 year after the surgery here, we can see that there is a water droplet inside the silicone content, and this is one sign of the loss of permeability of the shell of the implant. 1 year and a half later, she still have here the findings of the granuloma, but we have changes in the implant. There's more changes here than in the previous exam. And in 2019, we can see there is here's still the intracapsular mass, the CBIC is bigger, and this patient didn't have the diagnosis of CBIC, but there is signs of intracapsular rupture of the implant, and her doctor, her surgeon provides the change of the implants. And here is the actual study of the patient. He didn't perform the en bloc capsulectomy of the patient, and we can see the diseased capsule here, and with inflammatory reaction in the skin, just in the same site of the where we have the granuloma. So this is a complication when we don't have the en bloc capsulectomy. Another case here is a case, we described a case of patient that we were sure that it's going to have the diagnosis of BIA-ALCL, and the imaging findings are just like the same. And here you can see the water droplets in both implants. So here we can infer that there is a permeability loss of the implant shell. And on the right breast, she had the granuloma, and on her left breast, she had infectious disease with a lot of fluid inside of the capsular environment. Here's the surgery. You have here's the collection inside. And when we look to the histology, this patient had a monoclonal reaction with a lot of T cell and with CD30 positive, but it's not a lot of CD30 positive, so she didn't have the diagnosis of BIA-ALCL and only the diagnosis of capsular contracture. But we also can find some macrophages with Fumi macrophages. The Fumi is geositized here, and that infers that she had the breast implant illness, probably because she had the silicone granuloma. So we created this blog where we report our findings regarding the granuloma. And I also wrote this book where I tell the story of my journey regarding the breast implants and the breast implant illness. I think it's very interesting, and it's available in these online stores. And I like to thank the opportunity to share with you my experiences regarding the breast implant. And we're going to see what's going to happen with implants next time, because especially at the end of September, the FDA, they announced that they have a lot of regulations regarding the implants, and probably are going to have more news in the next months. Thank you for your attention.